Thank you very much. And thank you, Mario, and the hosts for the kind invitation to your conference. Unfortunately, as you see, I won't be able to speak freely to you, but will be forced to stick to my written notes because I don't have enough practice presenting in English. So we are very happy to be here and eager to hear more about the challenges you and substance-supported psychotherapy are facing here in Croatia. Karsten and I, we live and work together in Switzerland in a small, it's called canton called Solothurn, in a community that has developed in a field around the work with psychedelic substances in a therapeutic context. So that's a special history. But let me start with my short presentation so that we can stick to the given time structure. Unfortunately, we will not be able to cover all the topics we have announced within the given time frame. However, we will hopefully have the opportunity to discuss some of them in person later. I thought it might make sense to give you a brief overview of the development of psychedelics-assisted therapy, which I will name PAT in my lesson, my lecture in Switzerland, as an introduction, because I assume that here in Croatia, you're looking for possible ways to establish this therapy within your given legal and social framework, and that our path might be an inspiration for you. So the next 2 or 3 slides will be a lot of text. I hope this will work. The current practice of psychedelic-assisted psychotherapy in Switzerland. So that's the history, between 1988 and 1993, some doctors, all members of the SEPT, which is the Swiss Association for Psychedelic Therapy, SEPT, were authorized by the Federal Office of Public Health to treat patients with LSD and MDMA. One of these 5 psychiatrists was Samuel Wittmer, who died in 2017 and with whom Karsten and I trained as psychedelic therapists. After a longer break in 2014, Switzerland became the only country in the world to allow the National Health Authority to provide treatment with LSD and MDMA on a case-by-case basis. So this is the basis we are working on. It's a case-by-case basis. Psilocybin was added in 2021. This was preceded by various approvals of pioneering human research projects in clinical and outpatient settings between 1997 and 2013. Here, probably you know some of these names. It's Peter Gasser, Hisek, Lichty, Wallenweider, Öhen. Peter Gasser's outpatient LSD study of 2007, the world's first study with LSD after the Great Depression between the 70s and the 2000s, was particularly important here, or it was definitely important here, his study of 2007, which led to the allowment in 2014. And Peter Gasser was also trained by Samuel Wittmer. Since 2014, psychedelic-assisted therapies outside of research projects have been possible in Switzerland with exceptional approval from the health authorities, from the federal office. So exceptional approval, this is the term. The basis for this is an exemption article in the Narcotics Act. It's Article 8, Paragraph 5, according to which a permit can be issued in exceptional cases for the substances in the highest prohibition level, which is list D in Switzerland, if it is for the limited medical use of treating serious illnesses. I'm deliberately pointing out this legal detail because I think it might be worthwhile for you to check your legal basis to see if there's any possible entrances, if there are any possible entrances for this form of therapy to be implemented. So, PAT is not a first choice treatment, only considered for people who have already undergone several other psychotherapeutic or psychopharmacological therapies without lasting success. The only exception to the federal office's exceptional authorizations in this regard is the treatment of cancer patients who are struggling with this existential anxiety in the context of severe physical illness. The comprehensible reason for this is that there's often little remaining time. In regulatory terms, PAT in Switzerland is a restricted medical use of an otherwise prohibited substance based on an exceptional authorization, of an otherwise prohibited substance based on an exceptional authorization from the federal office. From a therapeutic perspective, we use the term psychedelic assisted therapy, PAT. In addition to its suitability in terms of content, PAT has the advantage that this term is gaining international acceptance. So now a few numbers about PAT. In Switzerland, more than 1,000 licenses for restricted medical use have been issued to around 60 doctors since 2014. It is estimated that around 2,000 to 3,000 psychedelic treatments with MDMA, LSD, and psilocybin have taken place. Concrete figures are currently available for the years 2016 up to 2023. During this period, there were a total of 1,051 authorizations, initial authorizations and continuations, of which 351 were for MDMA, 338 for LSD, and in the years 2021 to 23, 362 for psilocybin, which means that psilocybin takes up a disproportionately large share, about 1/3, but over a much shorter period of only 2 years, which in my opinion has to do with a very positive data situation for psilocybin. Mm-hmm. So these are the main and potential indications. The main indications are depression, as we heard in the morning, PTSD, and anxiety disorders. And then there are more diagnoses, which I call potential indications or potential diagnoses, which are addictive disorders, obsessive compulsive disorders, and existential crisis, the cancer situation, terminal illnesses. Potentially means that, I quote, this is the text from the Federal Office, subjects to convincing justification and compliance with the criteria for limited medical use. The Federal Office may also grant authorizations for additional indications and individual cases. End quote. So the Federal Office's bar is a little bit higher here. And here it should be said that our experience are well in line with new scientific data that strongly suggests that psychedelic therapy has a high transdiagnostic potential. Here are the dosages of the substances we use. Probably you know them, or most of you. It's 75 to 125 milligram for MDMA, 50 to 200 microgram for LSD, and 20 to 30 milligram for psilocybin. Ketamine is 1.5 to 1 milligram per kilogram body weight. And then there is microdosing with LSD, psilocybin, or others. And what's important here, I thought it's worth to mention, is neuroatopia. So we have, with the neuroatopia, our experiences are that in most cases you need lower doses, but much lower doses sometimes. But there are cases you need higher doses as well. So both is possible with neuroatopia. And think about neuroatopia if somebody's not responding to a substance, or if he's overwhelmed or overdosed. This is the procedure, the PAT procedure. It's preparation, then the experience itself, the substance experience, and then the integration. In our work, PAT is regularly embedded in a more or less longer-term psychotherapy. Or at least we do several preparation sessions, including preparation and education in the run-up to a PAT. And usually several integration sessions as well. Warte mal, geh nochmal. Zurück. Yes, integration is therapeutic debriefing, anchoring insights, and long-term implementation in everyday life. That's I think you know that, but it's worth to mention it again and again. Integration is the main thing, the big thing. The psychedelic therapist and the importance of set and setting. Set and setting are decisive for effect and integration. We heard that in the morning as well by Tommaso. The appropriate therapeutic attitude, openness, presence, empathy as a necessary basic attitude in the therapeutic relationship. Developed therapeutic relationship as an additional potent factor. Independent of some therapeutic relationship, independent of the therapeutic setting, a decisive factor in therapy is the quality of the therapeutic relationship, which, according to Klaus Grave, maybe you know him, the great German Swiss psychotherapy researcher, should be characterized by empathy, appreciation, coherence, integrity, and authenticity. 20? Yes. Thanks. Then, gehst du mal kurz zurück? Nochmal kurz zurück. Support instead of control, and awareness of the inner healing intelligence of the substances and the psychedelic process. Inner healing intelligence. In other words, the therapist's task is to give space to this, often not entirely rationally explainable, even magical process, and to be able to put aside his personal influence on it. In a way, this seems like a contradiction. The therapist is important for the psychological process, and at the same time, he or she should not be in the foreground. More about the therapist, self-awareness as the basis or prerequisite for a deeper understanding of the psychedelic process. I think it's so important, very important, the self-awareness, but yeah, we could take an hour to talk about that. The therapeutic couple as the gold standard. Healing takes place in relationship, and the therapeutic couple offers the most diverse of all possibilities. So it's ideal, for me it's an ideal setting, but it's not a must, that's clear. Group therapy in progress of the first of single setting in the beginning, with the healing potential of resonance and community experience and the economic benefit. And then it's all a question that's clear, it's all a question of resources and feasibility. Mm-hmm. Central themes of the psycholytic process: confrontation with pain and suffering. Interesting here is that scientific data shows us that difficult and painful conditions and experiences under the influence of substances correlate with positive effects. Dying, death, and rebirth, and different levels of consciousness, which are the ego or self, the first point of death, what we call it point of death, the collective consciousness, the archetypical consciousness, unity, and diamond luminosity, diamond light. These are terms of Chris Beach. Then maps of the human individual and collective psyche is a very helpful tool for the psychedelic psychotherapist. We know maps of Stanislav Grof, Samuel Whitmer, who I mentioned, and Christopher Beach. There are others, but we are working with them, yeah. These maps are experiential knowledge, which means they are tangible, and one's own experience is one of the most valuable tools of the psychedelic therapist. Excellent. Yeah, this is, geh nochmal kurz zurück. This is Stanislav Grof and his map of the perinatal matrices. Then these are books of Samuel Whitmer. This is his first one. He wrote about 40 on the left side, listening into the heart of things. And it's underwritten with the undesired psychotherapy, which is your name, the name you choose for your movement. I like that. Okay. Yes, this is a map by Samuel, the layer model of the feelings. Then this is another one, another map by Samuel, the energy system. This is Chris Page, his book LSD and the Mind of the Universe, which is a real diamond from heaven. So you should read it if you want. Okay.
Okay, then we switch. Thank you very much. Yes, it's funny for me now to have two of these things in my hand. Thank you that you are still there. Maybe you're completely tired, and I try to talk more fluently, and maybe it's interesting for you. First of all, I want to introduce myself, because I have some I've chosen a special perspective to the subject because I think it's not purely science, but it's also that what we are doing and that what we are hearing today is also something which is posed in some kind of political framework or the framework of the society. So I will always move a little bit through these different areas, and you will maybe be astonished the way I start now. So that means that normally I'm a psychiatrist and a psychotherapist, but also I would, there's the pointer, yes, but I also would look at me as a kind of political activist, and you will see why. So, I live in Switzerland, but I'm German, and it's funny for me to come to Croatia, and we have a bad history, for example, in the last 100 years, Germans and meeting Croatia. And one famous philosopher after the 1945 said, finally, all political education should be centered on ensuring that Auschwitz does not repeat itself. And if you transform that to psychotherapy, of course, we should not manipulate anybody, but I think we should keep in mind that psychotherapeutic work has to keep in mind that Auschwitz may never happen again. I think this is also a very important point, especially in the time today. And so we have to look at that more closely in the lecture. And as a German, I always like philosophy, and I also like that what Mr. Kant said some 200 years or maybe 300 years before. And he said that the area of enlightenment, it's meaning the philosophical time of enlightenment, he explained what it means, and he said humanity itself is immature, and to become mature as we look at it now as a kind of human being which is tries to fulfill its life, to lead a lucky life, and to live in freedom. It needs some aspects, and the most important thing for that is freedom, he said. Tommaso also talked about that before. Freedom in the special way, that means the way of using your speech and discussion and reasoning and making public use of one's reason in all respects. And to talk about that, it is very difficult to talk about drugs because it's a taboo theme. So if I ask you here now, please don't lift your hands now, but if I ask you whoever took drugs, then maybe if you feel to it, you think, I don't want to talk about that. Do I want to lift my hand or do I not want to lift my hand? So it's an interesting subject. And now if you are in contact with that, you are in contact with the taboo around drugs. And I was going deeper into that subject and having lectures about tabuization. And it's very interesting if you look closely at that, how emperors, for example, make taboos around themselves so that you may not criticize them. So it's I think it's a very important subject. Also now with psychedelics, and Tommaso already talked about this about David Nutt, who made this study, and so I don't have to go very much deeper into that. But I think it's always important to start with that point. When he did the study in 2010, he had the question, well, we have the laws, and are the laws which are the guidelines for us and for nearly every country in the world, are they based on science or are they based on ideology or idea or narratives, you know? And you have seen these pictures, and I think it's very important always to start, if you talk about psychotherapy with drugs, you have to keep in mind what are the facts. The facts are this. So there are some factors which they use to come to the score. What harm do drugs have? It's the toxicity, it's the question of dependence, and also the question, what injury does it to other people if somebody takes drugs? For example, alcohol. You know that violence very often happens by people who took alcohol. And the reason why I have that is that we have already a good use with drugs, meaning this is sugar, of course, but the same amount of caffeine would kill you. So probably you have taken some drugs today, mainly coffee, and so if you would take that, in that amount of coffee, you would die. So it's an interesting thing. You know, you have already a good use with several kinds of drugs, which are not very dangerous, and we saw that picture before. I won't go into that anymore, but in Switzerland, there was the University of Geneva. They were asked by the Ministry of Health, well, is the study of David Nutt, is it a good study? Is it well made? Can we rely on it? And the University of Geneva said, well, very, very good study. We like it. You have to base politics on that. So if you argue for that, this study is Swiss approved, so no questions anymore, I think. Not really, of course. So, yes, and parallel to that event, meaning the study of 2010, the studies about psychedelics started to rise up. Here you have therapeutic studies about psilocybin and MDMA, and the rise after 2010 coming there's another study from a European study, and then they started to have more trials with it. So this is, on one hand, it's a kind of success story. Of course, we don't know what the outcome will be in the end, but there's much going on, and based on the fact that normal drugs are not as dangerous as we think. Yes, so when you were talking about indications, I want to talk a little bit about contraindications. And there is very important that at any time, nobody should be like forced or brought into, convinced to do such a therapy. You can bring it in, you can give it as a choice, but you should not say to anybody, oh, this is the best thing in the world, it will help you, it will heal you, it's just take the pill and you are well. It will not work out like that. So it's a possibility, and you need special people to have a special mindset of the people who are able to take it, because it is a strange experience. And as Sebastian said already, it is not only taking a pill like any other. It makes some psychic process which needs to be handled, you know. And the will of the client also is very important, but it's not beyond the contraindications, which I will go into now. So, of course, there are some somatic contraindications, like cardiovascular diseases, acute myocardial infarction, the arrhythmias. You have to really talk with the people. You have to make a laboratory before. You really have to have a good anamnesis, biographical anamnesis, to know about the illnesses, and you have to know a little bit about medicine to include somebody in such a process. Not only for studies, there it's of course, but also if we work in Switzerland, we also have to check. Also, chronic physical illnesses like heart failure, arterial hypertension. Of course, hypertension is not an absolute contraindication, but you need to know which medicals does one take, which is the blood pressure on a good level. And we are lucky that we have a pharmacologist in Basel who gives a list which medicals work together and which not. It is still in work, but it's always coming more information about it. But it's very good to have that and to be sure. Yes, now we come to psychocontraindications. Don't be astonished. There are, of course, several illnesses. For example, psychosis. You should be very careful with dementia. You know, if somebody just is on the limit of his psychic ability, then this process might not make any sense. But of course, there are studies going on, and we have information about people who are starting with dementia, and with LSD, they start to remember things again which you didn't remember before. So there are a lot of also psychological illnesses which you have to be careful about. And if we talk about traumatization, dissociative personality disorder, PTSD and such things, they are, of course, on one hand, they are indications. On the other hand, there might be aspects where you have to be careful. For example, with PTSD, you should not work in a group setting, because talking about your trauma in a group might traumatize the others. So this is always a kind of single therapy with only one person. And also you have to be careful with emotionally unstable persons, because they need, before you need some kind of stability, some kind of respect of the therapy and the therapist, and this will be especially a problem with narcissistic and dissocial personality disorders. And we had a funny interview in 2011 about a German politician who was called to be very narcissistic. And here we have Christian Reich. He was famous, he's died now, but he was famous for encyclopedia about psychoactive plants. And he said, well, would it be good to give Mr. Gutenberg, or I don't know which guy is that there? He looks very angry. But I'm not sure whether you should give him anything like these drugs. Some people think that you should, but Dr. Reich says don't do that, because he already is so drunk by his own transmitters. He said, I would say, boy, go into the forest on your own, look at the trees, and if you like one, sit down by the trunk and stay there for hours, and I'm sure that would mean hell for him. I think this is true for all hard narcissists. I don't know what to do with them. I don't know how to heal them. We have a big problem with these guys. So what you have to do before you start with such therapy, you need to evaluate the personality structure level. You need to know, is it a person who is a kind of responsible, respective, who can take guidance in the process, or does he always reject it and stand up and switch off the music and say, oh, now I'm the therapist, you know? And that's a little bit difficult situations. If you evaluate it, then you might avoid such situations, but not always, so be careful. Yes, so what is the situation today? The situation is, sorry, I need a little bit drunk. The situation is, as Mr. Strasser from Basel said once in a lecture, anyone and everyone can buy and consume any drug they want at any time. That is the situation in Switzerland, in the EU, in the whole Europe, America. So what can we do in that situation? So we have two different situations. We have, on one hand, we have this therapeutic, and on the other hand, the recreational or ritual use of the substances. And there is, of course, there's a line between that. So what might be a contraindication in the substance-supported self-experience, we know that people are doing that, and we know if we look at the setting of the recreational use, it's not so dangerous. But still, there are contraindications for that. So what can be a contraindication privately can be and will be an indication in the legal psychedelic assisted psychotherapy. So you have to look at that closely and the different settings and for whom it is good and for whom it is not good in a private setting or in a therapeutic legal setting. You know, there are many countries where it is allowed to take such drugs. Switzerland is forbidden, as in the most of them. But for example, Portugal, they are very open with their laws. I think here also, as you told me, Netherlands, or if you go to Brazil for an ayahuasca ritual, well, it's part of the culture, you know. Yes, so I have a special subject now for the finish for you, because the aspect of relationship, a special problem concerning the special setting. On one hand, as we heard in the lecture in Sarajevo, relationships are the agents of change. And the most powerful therapy is human love. So what do you understand when I talk about, or he talks about love? Everybody has another idea of what that is. And I have another definition or another warning for you. Love is always blind, but it must not be confused with passion, which makes blind. So you have to be very aware what you are doing, what you are feeling. And sexual attraction, of course, is always a special situation, a special problem in psychotherapies. And on the one hand, you have a client who is in a special mindset and an altered personality state. And sometimes the clients see the personality of the therapist quite closely, and you feel, oh, now he sees me and he knows who I am really. It's really a funny experience. And on the other hand, the client is more vulnerable and less reactive to dissonant physical contact, for example. So you really have to be very sensitive and very careful if you work with patients. And of course, ethical standards are very important, but sometimes they are just so rigid. Don't do that, never do that, and you feel like this rather in a shell, you know. And love understood as a well-meaning global ability of seeing oneself and others might help to judge more fluently and act more adequate to the sake of the clients. So I think both are important. You have the rules, but also you have your feeling, your intuition, and you are challenged, the therapists are always challenged that to ask, is this intervention, is that what I'm doing the way you need me, is this correct for you and for the situation and for the sake of all of it? Yes. This is a quote from Mr. Reich. I won't go over it all over it, but it's very interesting. A little man does not know he is little and he is afraid to know. I don't know whom he's talking about. He hides his pettiness and narrowness behind illusions of strength and greatness, someone else's strength and greatness. He is proud of his great generals, but not of himself. He admires the idea he has not had, not the one he has had. So read Wilhelm Reich. He is also a very good reference for deep work with psychedelics, although he didn't know about that. So we come to an end. My favorite hobby. Thank you very much for listening. And if you have further questions, we'll give answers. We try to give answers.
Can we get another microphone, or is it one?
Which?
Who was first? I was late, but yeah, Martina, let's go ahead. Just stand up, yeah.
Thank you for your presentation. I would ask, you were mentioning Stanislav Grof, and probably you're familiar with the holotropic breathwork. Maybe if you have some kind of data or experiences regarding similarities or differences between two methods, so working with psychedelics and holotropic breathwork, if you know something. Thank you.
Well, he found in the beginning when he went to America, he was allowed to do the work like it did before. But after the 70s and the time was going on, he wasn't able to do it. And from his wife, he was a yoga teacher, he developed this kind of holotropic breath work, and also works very good. I have the feeling, from my own experience, I think it's good, but not as deep as psychedelics work. And so I know a lot of people who say, well, first I do holotropic breathwork with a client, and if he reacts positively with it, and he can stick to the setting, like just laying calmly down, relax, breathing, and take the emotional wave that is making, because that's also what is happening with substances. You have a big emotional wave, and you have to be like a bowl, which is stable enough to keep these emotions and to experience the emotions, which is a kind of personality trait, being able to experience and hold strong emotions. And if you experience that in holotropic breath work, it's a good step before, or you simply do that and have it. It's a very good attempt.
And I think, I don't know if every holotropic session was a sober holotropic session, and I am, yeah, and it's seriously. If you want to implement this therapy, which what is very, very difficult, you know that, and we all know that, you have to be creative. So, yeah.
Thank you for your answer. Just to be fair, we're going to answer one question from our online participants. So they asked us about your thoughts on, or experiences or knowledge about work with psychedelics with autism or neurodivergent population.
Yes. Yeah, it's that what Sebastian said already. There are, on one hand, there is a lot of research going on, and on the other hand, you might have the situation that, especially with autistic disturbances, some of them need very low dosages, and some of them need more, and you never know. So you start low and try to find out the right dosages, but that's the reason why you should check what person do you have in front of you, and you really have a good evaluation before, and then you have to find out after the first process, which might be the right thing. In former times, it was so that, well, it's the aspect of psychoanalysis always was to lower the protective mechanisms in the psyche. And today we have the experience, everybody is a little bit nervous now in the world, and the experience is you seldomly use 200 micrograms of LSD in a session, because everybody is already quite sensitive, and especially with neurodiversity, there's you don't know before.
Oh, okay, thank you. Yeah, great. Question there, yeah. Sorry. So just stand up.
Thank you for your information, very important. I have a technical question. You use in the therapy the original LSD 25 from Albert Hofmann. And my question
from
is...
the pharmacy.
From the pharmacy. And my question is, in Europe you can use the LSD derivatives legal in Germany, Czech Republic, Netherlands for sure. And the doses is the same, or is these derivatives weaker, or?
As far as we know, the dosage is the same, but from experiences of people who chose that substance, they say it took a little bit more time till the effect was there, but the dosage is usually the same.
Because they digest in the body,
yes.
And not...
It has to be changed in the liver, and then it's activated, and then it works.
Thank you so much.
We have a question here.
Okay, thank you so much for a wonderful presentation. I have one question. So is it possible to receive psychedelic assisted therapy in private practice in Switzerland, or is it only available in public hospitals, and how is it the system treatment organized?
Yes, it is. It is. So both. It's you know, you have a very, very comfortable situation in Switzerland. As in Germany, you can have psychotherapy via the normal insurance companies, and in that you also can practice with these substances, and in the surgery, also in a hospital. In a hospital, they work with group settings also in addictive psychiatries, and so this is a very comfortable situation there. It's you know, there are so many millionaires in Switzerland. It's very nice there. I'm not, sorry.
Thank you for your answer. So we had one question here before.
Yeah, hi. It was just to come to the slide which was to do with the cautions and contraindications. I just wanted to pick up particularly on the bipolar.
Yes.
And I just wanted your reflections on, I think there is data already in bipolar 2 patients and their trials undergoing process with Compass. I'd just like to ask your impression and take on the total exclusion of people with bipolar.
Yes. I really wanted to point that out. It's nothing is. Now, some of the somatic illnesses are definitely absolute contraindications, but from the psychic aspects, of course, somebody with a schizophrenia don't do. But the most of them bipolar disorder, that might be different, a different situation. How long was the last episode? And that it's not but just the idea is rather keep it in mind that there is something, and you have to check.
Okay, thank you. We have time for a few more questions.
So then I give another. So we take a question, then I give another question to the audience.
We can do that as well. Feel free. Yeah, we have one here.
Yeah, thank you both. Wonderful lecture. If you could give one or two advice to the therapists who are starting in the training of a psychedelic assisted therapy, what would it be?
Start as you always do in psychotherapy. Start with self-experience in a good, controlled way, which is, of course, is forbidden. And that's one really difficult thing. I can't recommend it anywhere, so cut that out, what I said before. But the point is, you know, there are 2 lines. One line is, well, there's some kind of strange substance, just give it and it works somehow. And you look for the results, you know. And on the other, and these are the guys who say, well, there's some strange, like a dream, you know. I always have patients who have a dream and say, oh, so stupid dream then. And no, it's not stupid. What was the dream? And then we work with the dream. It's very, very interesting always. So that what the process is very, very important. And so just say, give the substance and it helps is simply not enough. What we say is it's a form of psychotherapy with a catalysator of the substance. So if you bring somebody, don't bring somebody to a process which you yourself don't know. So if you want to make a walk in the mountainside, which will have dangerous places maybe, would it be enough to take a book, or would you rather like to have a guide who knows the mountains?
Great, that's interesting answer. Sebastian, do you have a different advice for?
Maybe it's, you know that, but it's substance-assisted therapy is not a therapy for itself. So I think you should educate, you should learn psychotherapy in some kind of school. Do your education there. Profound education, and then you take the substance-assisted therapy. You take it together. And I think that's important to say. It's not therapy itself. So you have to learn about therapy a lot, theoretically, and it's good to learn at school what we have to in our education as a psychiatrist, and then you take it as an additional. It's a method inside a bigger thing. And then I think it's very helpful what we had. It's very helpful if you want to learn about substance-assisted therapy to exchange, to do it together in a group. If you have that possibility to exchange, to work together, to explore together this huge field. So I think you have that here. Or you're starting with to build up such a field. Yeah.
And they have it in Switzerland. They start to have it in Germany, and then in one way they have it in America with MAPS. That's where we met. So this is very important to have a field where you can have exchange.
And be creative, yes, and courageous.
So I have one more question for you, because I was concerned with, we didn't talk at all about spirituality in this seminar here. And but when I was looking for where I'm going to Croatia, and I know that 84% are Catholic, and some Muslims here, so there might be a problem sometimes in the field, So if it's like that, in America I read 54% believe in the existence of hell. Who in this audience believes in the existence of hell? Now it's not a taboo. Oh, yes, it is a taboo, but you can answer. So, the question, do you believe or not? It's a very, very important question, because if you have an experience from a psychoanalytic point of view, these entities like devil, demons, they are projections of the subconscious of one's own mind, which have to be explored and understood. So there you work with that, and if you see suddenly in a framework, see your therapist, who is a normal, friendly therapist, and he sees, it was described by Groff in the beginning of the work, suddenly he gets a face that looks like a devil, and is the devil, is this now here? So it's a very difficult situation for that. And if one hardly believes in that, and if one doesn't differentiate between a spiritual process and the psychological process, you have a problem, So how will you cope in a situation in a psychedelic session when a person is experiencing a bad trip? No problem with a bad trip, because it's a self-experience. You just go through it. It will end at some time, and you do some integrational work after it. But if he really believes that the devil he sees is there, you have a problem. So you really also have to prepare and look what are the beliefs, what is the spiritual position of the participant, to have a look for that, and it makes a completely different process if somebody goes into that. Pardon? You cannot tell the patient there's no devil. No. Yes, you cannot say there's no devil. So, oh yes, you're a friend of a devil, and you don't want. So you're already in it. So no problem. So, and we know that is going on in the world at the moment. If you are against some narcissistic person, you're a friend of the enemy. So you're also already in it. Very dangerous.
That's really very interesting area. Okay, so we have questions. Maybe 1, 2 questions. So many hands. You were first before.
Hi. You were talking about the work with the narcissistic patients, or patients that have narcissistic tendencies. And at one point you mentioned, I don't really know how to work with them. But I was a little bit surprised by, identification that you did saying that, because it's not who they are. Those are their parts. So what is your perspective on how do you work with patients who have narcissistic parts?
Yeah, Of course, that's a very good question, because I'm a little bit, in the lecture, I'm a little bit putting black and white, to look for the subject. But as you say, normally there are only narcissistic parts. And for my own guideline, I say, if you feel in the contact, you feel the heart of the person, and there's a good trusted relationship, then it can be very nice to work with narcissistic persons and also with borderline personality disorders, because you feel, oh, he has some problem, and he's narcissistic, and he asks in which university you have studied, did you do a good degree maybe, but you feel the heart of the person. But if you don't feel it, if everything is cold, and he always criticizes you, and he always says, he cannot take anything from you. He always says, oh no, I know it better than you. Don't do it. It's just, it doesn't work, and it's such a sensitive field. We are maybe in 100 years, because if it's really established and it's a safe therapy, also that in the society people say, well, it's a good thing, you should do it. Like with psychotherapy, 30 years ago, if you go to psychotherapy, you have to hide away and go to some other town. Today, I'm going to psychotherapy, and many people say, yeah, it's a good thing, you should do it. But we are not there at the moment with psychedelics.
Thank you. One last one. Long time.
Okay, thank you. So I have one medical question. If you're working with a patient who is older, let's say older than 65 years, and has hypertension, but is controlled by medications, how would you start with, for example, MDMA? Would you reduce the dose, and how would you titrate the dose?
Yes, from that age on, one should. It's not, that's one drawback. We have experiences, but we have no hard guidelines in Switzerland. It's very nice that we are not in the EU, because we can do all that funny stuff, and we don't have this process, which I didn't understand. Sorry, but was very interesting about how the ways are, and I hope Europe is doing their job well, apart from the US. But so the idea is from 60 or 65. Differentiating whom you have. You want to have a laboratory. You want to know, are there any cardiac diseases, and have an ECG, and also with a bicycle. So if he is make a good process on the bike with the ECG and the hypertension as well, then you could work with a normal dosage. But otherwise, yes, you start with a low dose, and you find out.
Thank you. That's an interesting question, because here in Croatia we have hypertension as our middle name. Yeah, so
terrible disease.
Yeah, I think Sebastian and Karsten, they're here all day. You can catch them between lectures or at our after party. On our after party, we have with our DJ, so it's gonna be non-formal. You can ask them anything. They're really open, to sharing their experiences, and it's really valuable. I know we all have a ton of questions, but we don't have that much time, and our lunch is getting cold. So I will once again give a big shout out and thank you to Karsten and Sebastian.